New COVID-19 vaccine mandates announced from coast to coast. More than 50 medical groups issued a joint statement. They're calling for mandatory vaccinations of all healthcare workers. And then there's New York City requiring employees to be vaccinated by mid-September. We're talking about more than 300,000 people. Right? They'll get tested weekly. California is issuing the same guidance for their state employees. So this is critical, folks. The Department of Veteran Affairs is now the first federal agency to require its healthcare employees to be vaccinated. And all of this comes as misinformation about the vaccine continues to spread. They're still doing it, still at it. It's spreading as fast as the Delta variant, which is very dangerous. So let's talk about all of it. Friend to the show, the man in the know, Dr. Bernard Ashby returns. He's a cardiologist, top of his profession, Florida, and state lead for the Committee to Protect Medicare. Dr. Ashby, welcome back. I'm glad they gave me this segment today because I need you. I need to talk to you. Okay, because I've had enough as a parent of a child who cannot yet qualify for this vaccine. And here's where we are. Things look critical. And over the past week, Florida accounted for nearly a quarter of all cases in the United States. Just let that sink in, where you are, more than any other state. So you're on the front lines, and I want to know what you're seeing up close, because this Delta variant, it's very scary.
Yeah, good morning, Sharon. And you are right. The Delta variant is very scary. What most folks don't realize is that this particular variant, when compared to the original version of the coronavirus, has 1,000 times the viral load and a significantly shorter incubation time, which equates to more likelihood of the infection spreading amongst the population. And as long as people are unvaccinated, this Delta variant is going to continue to do what it's been doing around the world, what it did in India, what it did in the UK, and what it did in multiple other countries, which is spread like wildfire. And we're seeing that right now, particularly in Florida, where we have zero, I'm being hyperbolic, but almost zero mitigation measures to prevent the spread of the virus. And you see that in the numbers that you quoted, and it's unfortunate.
Yeah, it is, and it's worse than zero mitigation. You actually have politicians down there playing with people's lives who are fighting to make sure you don't put measures in place like mask mandates and the like. It's just so ugly. It really is. 56 medical organizations want all healthcare workers to get the shot. Okay, what are your thoughts on that approach? Because in the past you've said that, hey, look, if you had COVID and the antibodies and maybe you don't need the vaccine, where do you stand this morning?
Well, it's hard to ignore the data out of Israel, Qatar, Cleveland Clinic, Yale, all of which show that natural immunity is essentially on par with the vaccines. So that's something that needs to be factored into the policies. But I don't really want to focus on that. I mean, the point is that you have to build immunity around the most vulnerable patients, and the vaccines are a mitigation measure or an infection control measure because nosocomial infections, which are infections in the healthcare setting, are a real thing. And the pandemic has shown that that a large portion of roughly 200,000 folks who have died from the pandemic have lived in long-term care facilities. And quickly back to Florida. It's unfortunate that we have a governor that is playing politics with people's lives. You know, he got his vaccine, didn't tell anybody. He got it on a low, and then goes out and then spreads vaccine misinformation slash disinformation. And in fact, is advertising, these cooling mugs that say, how am I supposed to drink my beer with my mask on? I mean, this is a type of politics that actually is leading to people dying, and this is the worst form of it because it shows you how much they do not care about the lives of people. They would rather score political points than save lives. So it's outrageous.
Yeah, it's leading people. I don't think it's too strong a statement, Dr. Ashby, to say it's leading people to their graves. It really is. And so I need you to help us understand, because I'm just talking about lay people, okay? What are some of the reasons that you've heard from healthcare workers, okay? People who work in your industry who still don't want to get vaccinated. Why?
Well, it's important to realize that all healthcare workers aren't the same. Over 96% of physicians who are practicing have been vaccinated, and that's because we know the science.
Okay.
Now, there's a difference between the level of knowledge about immunity and vaccines between a physician, and then let's say someone that works in the loading area of a hospital. We're all considered healthcare workers, but we don't all have the same expertise, and they are immune to misinformation slash disinformation and hesitancy, just like the general population. And so it's important for us to, again, communicate clearly and avoid the politics. I mean, back to DeSantis. I mean, this guy actually came out and said that we physicians don't know what we're talking about. We're not well informed. He's also said that we're asking for lockdowns. No one ever said that. And he said that lockdowns won't affect us. Like, I'm not a small business owner. Like, I'm not a father. And so it's incredible to me that rather than listen to the professionals and the healthcare workers and the immunologists and the scientists who all are on the same page when it comes to these vaccines. They are safe, they are effective, they work. We're letting the evidence drive our decisions. And we have people who are our leaders who are using this opportunity to promote themselves and their own interests over and above the population. And to me, frankly, it's sick. And I don't mean that figuratively,
Yeah.
because it's literally making our country sick, and people are dying because of these politics that are being played.
Well,
And
listen,
frankly, I'm tired of it.
I'm angry. Yeah, I'm angry, and I'm going to close with this because we don't have too much more time. These breakthrough infections, because of the power, and I forget, you said it 1,000-fold or something, this Delta variant is just so aggressive. People like us, vaccinated, could likely get this infection. And I wonder if it's going to be like a bad flu. And then I'm angry because my daughter, again, she's not yet even 10, doesn't qualify for the vaccine. School's around the corner, and I wonder, should she even go? So talk me off the ledge, because as I walk down the street, there's people that I'm looking at them, okay, and I'm not understanding the lack of compassion and will to live, quite frankly.
Sharon, I share your concern as a father myself. It's highly concerning, really, when you send your child to get an education, to develop as a human being, only to realize that there is a potential threat and danger there. And again, it really comes down to us working as a community, really together to come up with these mitigation measures for folks who are eligible to get vaccinated, to go ahead and get vaccinated, for institutions such as schools and daycares to institute mask requirements so that these young children who don't qualify for the vaccines are protected. And I keep saying time and time again, we have to get back to the basics. I mean, it's all about the community. There's the African proverb, Ubuntu, I am because we are. That's what we need more of in our country. There's too many people saying I and worrying about themselves and not worrying about their grandmother or their fellow cousin or family member who are vulnerable, and we're seeing it in the death rates, and it's really unfortunate. And so I'm all for anything that decreases death, and that's really all I care about. I have no agenda other than seeing people live happy and healthy, and we need to get back to the basics when it comes to this virus.
Well, you might want to take that proverb up to the governor's mansion, the Florida governor's mansion, and start there. Because it's a very serious thing, leading people to their graves. I'll say it again. Dr. Bernard Ashby, thank you for joining us. We need you more than ever, so thank you. And do come back and keep going with this. Update us. Thank you, Dr. Ashby.